Hello and welcome. Today we're diving into a common yet often misunderstood condition, Detrusor overactivity, also known as OAB, or overactive bladder. We'll explore what it is, what causes it, how it's diagnosed, and what can be done about it. So, let's get started! What exactly triggers Detrusor overactivity? The causes can be quite diverse. Sometimes there's a clear neurological link stemming from conditions like stroke, multiple sclerosis, Parkinson's disease, or spinal cord injuries. These conditions disrupt the brain's control over bladder function. However, in many cases, the cause is idiopathic, meaning we simply don't know why it occurs. Other contributing factors can include bladder infections, bladder stones, tumors, or even changes in the bladder muscles themselves. Certain medications and excessive caffeine or alcohol intake can also play a role. In women, hormonal changes during menopause can also be a factor. To understand Detrusor overactivity, we need to delve into the bladder's normal function. The detrusor muscle is the smooth muscle that forms the bladder wall. Normally, it remains relaxed as the bladder fills with urine. When the bladder reaches a certain capacity, signals are sent to the brain, creating the sensation of needing to urinate. The brain then sends signals back to the bladder, triggering the detrusor muscle to contract and empty the bladder. In Detrusor overactivity, the detrusor muscle contracts involuntarily, even when the bladder isn't full. These involuntary contractions create a sudden and compelling urge to urinate, often leading to urgency and frequency. The precise mechanisms behind these involuntary contractions are still being researched, but it's believed to involve abnormalities in the signaling pathways between the bladder and the brain. Detrusor overactivity is a widespread problem, affecting millions of people worldwide. It's estimated to affect both men and women, with prevalence increasing with age. While the exact numbers vary depending on the study and population, it's safe to say that it's a significant public health concern. The condition can impact quality of life, leading to social isolation, anxiety, and depression. The telltale signs of Detrusor overactivity revolve around bladder control. The hallmark symptom is urinary urgency, a sudden, compelling need to urinate that's difficult to defer. This is often accompanied by urinary frequency, meaning urinating more than 8 times in 24 hours. Many individuals also experience nocturia, which is waking up 1 or more times during the night to urinate. Urge incontinence, the involuntary leakage of urine associated with a strong urge to urinate, is another common symptom. The combination of these symptoms can significantly disrupt daily life. Diagnosing Detrusor overactivity involves a thorough medical history, physical examination, and often, some specialized tests. Your doctor will ask about your symptoms, fluid intake, and any medications you're taking. A urine test will be performed to rule out any underlying infections or other medical conditions. A bladder diary, where you record your fluid intake, urination frequency, and any episodes of urgency or leakage, can be very helpful. Aerodynamic testing, which measures bladder pressure and function during filling and emptying, may be recommended to confirm the diagnosis and assess the severity of the condition. This test helps to determine if involuntary detrusor contractions are present. While Detrusor overactivity isn't typically classified into distinct types, in the same way as some other diseases, it's helpful to consider it in terms of severity and cause. For example, someone with mild symptoms might experience occasional urgency, while someone with severe symptoms may experience frequent incontinence. Also, as mentioned earlier, we can distinguish between cases caused by a known neurological condition as neurogenic Detrusor overactivity and those with no identifiable cause, idiopathic Detrusor overactivity. Understanding the underlying cause can help guide treatment strategies. Fortunately, there are several effective treatment options for Detrusor overactivity. The first line of treatment often involves behavioral therapies, such as bladder training. Bladder training involves gradually increasing the intervals between urinations to help the bladder hold more urine. Pelvic floor exercises, also known as Kegel exercises, can help strengthen the muscles that support the bladder and urethra. Lifestyle modifications, such as reducing caffeine and alcohol intake, can also make a difference. If behavioral therapies aren't enough, medications called antimuscarinics or beta-3 agonists can be prescribed to relax the detrusor muscle. In more severe cases, procedures like Botox injections into the bladder muscle or sacral nerve stimulation may be considered. Finding the right treatment often involves a trial-and-error approach, working closely with your doctor to find what works best for you. While completely preventing Detrusor overactivity isn't always possible, there are steps you can take to reduce your risk. Maintaining a healthy weight, avoiding excessive caffeine and alcohol, and practicing good bladder habits can all help. Regular pelvic floor exercises, especially for women after childbirth, can also be beneficial. Managing underlying medical conditions, such as diabetes and neurological disorders, is also important. The prognosis for individuals with Detrusor overactivity is generally good. While the condition can be bothersome and impact quality of life, it's usually manageable with appropriate treatment. With behavioral therapies, medications, and other interventions, many people can significantly reduce their symptoms and improve their bladder control. Recent research has focused on developing new medications with fewer side effects and more targeted therapies, such as gene therapy and novel neuromodulation techniques. Researchers are also working to better understand the underlying mechanisms of Detrusor overactivity to develop more effective prevention strategies. Thank you for joining us on this exploration of Detrusor overactivity. We hope you found this information helpful. Remember to consult with your healthcare provider for personalized advice and treatment.